Hello, everybody, and welcome to this next edition of the Pioneers of Healthy Lifespan Longevity Research Series. This is the third webinar that I've taught on this subject. Today, I want to feature one of my personal heroes, Dr. William Castelli, who is a medical doctor. He's the past medical director of the famous Framingham Heart Study. He was the medical director for 3 decades. During his term as the medical director, and even prior to that, when he was just part of the study as a researcher, one of the major findings that came out of Framingham was an understanding of how cholesterol participates in the development of cardiovascular disease. So we're going to see that today. So let's get started. Thanks for joining. We have a lot of people that registered for this particular webinar. Some are here live, some will get the recorded version of it later. But Dr. William Castelli achieved his bachelor's degree in zoology at Yale College, and then a doctor of medicine, surgery, and obstetrics from a university in Belgium. And then he did his internship in 1959. So when I was 4 years old, he was doing his internship at medical school in New York, and was also did his residency at a Boston hospital. And this led to a fellowship in rheumatology shortly thereafter, and then a fellowship at the Department of Preventive Medicine at Harvard Medical School. So he became interested in preventive medicine at a very early stage in his career. So this work continued even after he joined the Framingham Heart Study in 1965. So Dr. Castelli's associations with 3 medical schools in the area had led to this, sort of in the Boston Framingham area, led to his teaching epidemiology and prevention of atherosclerotic cardiovascular disease for 34 years at Harvard Medical School, 22 years at Boston University School of Medicine, and 15 years at the University of Massachusetts Medical School. So he is really a leading authority in atherosclerosis leading to cardiovascular disease. He's still alive today. He currently serves as medical director of a new wellness program at the Metro West Medical Center in Framingham, Massachusetts, a center which specializes in aggressive management of cardiovascular disease risk factors. Now, in 1979, Dr. Castelli became the 3rd director of the Framingham Heart Study, a post that he held for 3 decades. The Framingham Heart Study began in 1948 and continues today to provide important findings, not only related to cardiovascular medicine, but it also expanded to start looking at risk factors and interventions that could be successful in dementia, osteoporosis, osteoarthritis, cancer, pulmonary disease, hearing, and eye disorders. Framingham now includes 4 generations of participants. So we're getting a good look at how family history also affects risk of disease. There's over 1,000 scientific reports that they've published. It's an incredible study. And so here's how it came about. So during the 1940s, during the World War II era, of course, antibiotics were introduced, oral antibiotics, which helped to cure a lot of infectious diseases that, would otherwise lead to death. So with the decline in infectious diseases from antibiotics, what we then saw was that 44% of Americans were dying from cardiovascular disease. And in 1948, shortly after the end of World War II, nobody knew why. During World War II, soldiers were given free cigarettes. No one knew that that was a dangerous thing to do from a standpoint of lung cancer, emphysema, cardiovascular disease. Having a blood pressure of 188 over 105 as you got older was considered to be normal part of aging, not to be really anybody should be concerned about that. No one had any clue that high cholesterol was even a risk factor in the late 1940s. But during the World War II, when Franklin Roosevelt was the president, he had high blood pressure, which led to heart failure. He had a blood pressure of 300 over 190. His heart was failing. He was in very poor health towards the end of the war. He was prescribed digitalis for the heart failure problem. They put him on a sodium-restricted diet. They gave him phenobarbital to try to bring his blood pressure down. They had no drugs to bring his blood pressure down. but he died at age 63 from a cerebral hemorrhage. So Harry Truman was elected president in 1948, and because of Roosevelt's death from cardiovascular disease and the high prevalence of the disease in North America, he signed the National Heart Act and established a National Heart Institute. And the act included a $500,000 grant to start the Framingham Heart Study, which was to run for 20 years, but it extended well beyond that. The first director was Dr. Thomas Darber, a medical doctor. He recruited over 5,000 people living in Framingham, Massachusetts, between the ages of 28 and 62. And they had, every 6 months, they had physical exams, and they tracked these people for a period of time. The study started to prove to be very insightful, so there was funding that got put forward to extend it and expand the study, and Framingham became a very famous study that still operates today. So in the 1960s, one of the major discoveries from Framingham was that high blood pressure was a risk factor for cardiovascular disease. No one knew that. Up until then, normal blood pressure was considered to be 160/95. No one realized that having a blood pressure of 120/70 is really the target. And up until that point, there were no drugs to lower blood pressure, but diuretic drugs like furosemide and thiazide drugs were first introduced in the early 1960s. And so that became the first time you could actually lower blood pressure using medication. No one knew about exercise, CoQ10, hawthorn, calcium and magnesium, omega-3 fats. Those things were not on the radar yet. But these drugs started to appear to be a first line of defense against treatment. In 1967, so 2 years after William Castelli joined the Framingham team, he joined in 1965, there was enough data from the Framingham prospective study of these individuals that they published their first paper on the 7 risk factors for cardiovascular disease, which included things that we take for granted today: aging, systolic blood pressure, cigarette smoking, total cholesterol, ECG abnormalities, being overweight, high levels of hemoglobin thickening the blood. These things increase the risk of having a major cardiovascular event. It was the first time that was identified. It's 1967. Later, as things went further, as they looked at cholesterol, Castelli and his researchers started to see that LDL cholesterol was risky and HDL cholesterol seemed to lower the risk. And they didn't know why, so they investigated that. By 1998, they had enough data, while Castelli was the medical director, to publish what still exists today, which is the Framingham risk score for cardiovascular risk, where a medical doctor today still uses those parameters to determine the person's 10-year risk of having a major cardiovascular event, which I'll show you on the next slide. If your score is higher than a 10% risk, if your risk of having a major cardiovascular event is higher than 10%, that prompts a family doctor to start getting aggressive with their treatment, which usually involves drugs. If your score is less than 10%, they often will do nothing, because giving drugs also has side effects. So they're saying, well, we don't want to really introduce side effects that a person could avoid. So unless you have a big enough risk for cardiovascular disease, we're not going to do anything. But once you get over 10%, this is the medical rationale. I'm not saying the rationale is right. I'm saying if you have any risk for cardiovascular disease, you should get it down low. But I know it's hard to see these forms, and I'm going to send these forms to you. But what this shows is that these are the 2 forms for men. This is coronary disease risk prediction score for men based on LDL cholesterol levels. So first thing that happens is you look at the person's age in this box, and whatever their age is, they get a certain score, and you then put that score. Let's say the score is 2. You put the score in the age box here. Then you look at their LDL cholesterol. What range are they in? There's a score associated with that. You put that score in the LDL score box. Then you look at their HDL, and the lower their HDL, the higher their score is going to be. And then you look at blood pressure, and you put that score there. And then you look at diet. Are they a diabetic? Do they smoke cigarettes? And then you get a total number of points. Then you take those points and you go along, and then you plug it into the box, and you say, oh, your 10%, your risk of having a heart attack over the next 10 years is 7%. If the risk is only at 7% and it doesn't exceed 10%, then it's very unlikely that a medical doctor is going to even pay any attention to your risk, which I think is wrong. Personally, I think if you have a high LDL cholesterol, you should bring it down regardless of your risk, because it's still risky. It's just not risky enough to start introducing drug therapy. So there's the LDL based scoreboard, and then there's one where they use your total cholesterol instead of, so this box is LDL, this box is total cholesterol. Everything else remains the same, and you get points, and you put the points in and you see where you score. And if you're over 10%, then they take aggressive management to try to lower your risk. So these are the two forms for men. And on the next page are the two forms for women that are exactly the same, LDL, total cholesterol for women. So I'm sending these forms to you along with all the slides from this presentation in case you want to do the assessment on yourself, on your own patients, or understand how a family doctor uses this information. If you look at blood lab sheets that are used in Canada, it shows you, it tells the doctor how to calculate the 10-year risk. And the 10-year risk is based on the work of William Castelli and the Framingham research team during the period when Castelli was the medical director. So that's the history behind it. In 1985, the New York Times had this great article talking about the Framingham study and how they recruited half the middle-aged people living in Framingham, Massachusetts. Saying that perhaps the most important contribution was the understanding the risk between cholesterol levels and cardiovascular disease. No one had ever seen that before. And they make the point that a cholesterol level of 230 milligrams per deciliter, or 5.98 millimoles per liter, which we use in Canada, it carries twice the risk of heart disease as somebody who has a total cholesterol that's down at 4.68 millimoles per liter. And for people whose total cholesterol is 7.8, they have a four times greater risk of developing cardiovascular disease. And that's because cholesterol gets laid down in the artery wall and causes narrowing. One of the things that Castelli said, he said, in 34 years of Framingham, we've never seen anyone with a total cholesterol below 150 milligrams per deciliter, or in Canada, 3.9 millimoles per liter, who's ever developed coronary heart disease. And I think that is the cornerstone message here, is to get your own total cholesterol, as mine is, below 3.9 millimoles per liter, because that's where people don't have heart disease. So rather than waiting to get into a risk that's beyond 10%, you want to get that level down into the safest possible range, in my view, if longevity is on your radar. So Castelli became the medical director in 1979, but he really started in Framingham in 1965. He saw the correlation between cholesterol and heart attacks. He was one of the first people to identify this risk. He himself was able to lower his own cholesterol through diet and exercise. He originally had a high cholesterol reading himself of 6.24. He got it down to 5.2 just through diet and exercise alone. That's a very important lesson for your patients, that many times they can lower their own cholesterol without drugs. He was the first male family member to live beyond age 45. There was a huge family history of coronary disease that he was facing, and he's still alive today, even though his father developed serious problems. His brother developed serious problems when they were quite young. So he's one of the most famous people in the area of atherosclerosis, and I wanted you to know about him. I have a very detailed webinar on this. It's 1 hour long that I taught in the recent past. If you haven't seen it, you should really go and look at the details of how cholesterol is related to cardiovascular disease. I'll just hit a few of the highlights for you just to remind you of how arteries narrow and fill up with cholesterol plaque if you're not careful. When you're born, those arteries are wide open. Why do we fill them up with plaque and develop this disease in the first place? And once it becomes very advanced, you have all those foam cells that are full of LDL cholesterol narrowing the lumen of the artery, and you're just a sitting duck waiting for a heart attack, a stroke, peripheral vascular disease, vascular dementias. And a lot of times what happens is it's the left anterior descending artery, the LAD, which is the widowmaker. When that artery becomes clogged, the whole front wall of the heart becomes deprived of oxygen. And that's when you have angina and sudden death heart attacks. In fact, in 25 to 40% of cases, the first symptom of narrowing of the widowmaker artery is sudden death. So you can't just go by how you feel. You really need to know your numbers. And I'm going to show you what those numbers ought to be. You want to prevent blockage of that artery and all the other arteries in your body as well, of course. But as your total cholesterol rises, the risk of coronary events rises proportionally. You want to have a total cholesterol that's at 3.9 millimoles per liter or lower. If you can't reach that target, at least try to get to something around 4.7 or less. And in terms of LDL cholesterol as a standalone subfraction, you want it to be under 2.0, and ideally you want it to be under 1.8, and more ideally, you want it to be under 1.5, to be honest with you. That is really a great place to be for LDL. So how does cholesterol levels rise? Well, primarily, unless you have some major genetic defect in cholesterol clearance, when you eat saturated fat or trans fats or deep fried foods, as that saturated fat gets incorporated into the chylomicron in the intestinal tract, it travels to the liver. Most of it, not all of it, but most of it gets to the liver, and then the saturated fat gets put into a very low density lipoprotein particle. And in order for that to float properly, the liver turns on cholesterol production, and then it sends that. And so now there's cholesterol inside the VLDL, and it sends this out into the bloodstream, and the fat gets taken up by your fat cells. So your fat cells get larger. The fat gets burned by your muscle cells. And then what's left over is the remnant particle, which is the LDL cholesterol particle, which still has all the cholesterol in it. And many of the cells of the body have LDL receptors, so the cholesterol can get into the cell, and the cholesterol can be used to make the cell membrane, to make steroid hormones, to make bile acids, to make vitamin D. So the cholesterol has a purpose. But once all the cells of the body have all the cholesterol they need, they stop making these receptors, and the extra LDL stays in the circulation for 3 to 5 days. And the LDL, because on its outer surface, it has a protein called the ApoB protein, it penetrates the endothelial layer of the blood vessel and goes into the subendothelial space. Monocytes are attracted there, and the monocytes start eating the LDL cholesterol, and they become like the Michelin tire man. They form these huge foam cells, and this becomes the atherosclerotic plaque, which is basically just LDL cholesterol laden fat that's narrowing the arteries. Of course, the HDL does the opposite. The HDL is made by the liver. The HDL will go out and vacuum up some of that plaque, and it's like reverse cholesterol transport. So the higher your HDL, the greater is the chance you can reverse some of this damage over time. Now, when you eat polyunsaturated fats and monounsaturated fats, you still have to transport them in VLDLs and LDLs, but the thing is that those fats turn on more cholesterol receptors to clear the LDL from the circulation, so they don't end up raising your blood LDL cholesterol levels. So as Framingham got going in Europe, they started looking to see, is LDL also a factor? Is cholesterol is also a factor outside of the United States when it comes to cardiovascular disease? And in fact, that's exactly what we're seeing. In 2016, the European atherosclerosis study, Dr. Catapano in his interview said, high LDL cholesterol is a main culprit in risk of heart and cardiovascular disease. Diet and lifestyle should be the first line of defense to get those numbers down. He's saying the best LDL cholesterol is under 1.8, but truthfully, more recent studies are saying it should be under 1.5. There's a great new book in the marketplace by Peter Attia, a longevity book, saying you can't have an LDL cholesterol that's too low. Just get it as low as you possibly can. And as you age, men are twice as likely as women to have sudden cardiac death just from the aging process alone. But if you start adding risk factors like LDL cholesterol, high blood pressure, and so on, the risk becomes greater. And then in Britain, we see the same thing. 2016 study says we're just confirming what we've seen over many years. The more saturated fat you eat, the greater is the risk of heart disease, as we followed 115,000 male and female healthcare practitioners. An 18% greater risk of heart disease in the group consuming the highest amount of saturated fat. Not just any saturated fat, but long-chain saturated fatty acids, particularly lauric acid, myristic acid, and palmitic acid. Where do you find those? In meat and dairy products. Beef products are very high in palmitic acid, so is pork. a lot of processed meats, hot dogs, salami, bacon, sausages, heart disease promoting fats. Same with high fat dairy products. Even anything over 2% milk or yogurt is already too much myristic acid. Cheese is off the charts. It's ridiculous. Same with coconut oil. People think, well, it has medium chain triglycerides. They're good for you. Well, the medium chain triglycerides are good for you if you just want to buy a strict medium chain triglyceride oil. But coconut oil itself, most of the fat is actually lauric acid, myristic acid, and palmitic acid. And it's been shown to raise LDL cholesterols quite significantly. When people change to healthier foods that have a better fatty acid profile, it often lowers their risk of heart disease quite significantly. Studies comparing coconut oil consumption to consumption of other vegetable oils, avocado and other vegetable oils in head-to-head trials show that coconut oil raises total cholesterol and LDL cholesterol quite significantly. So this popularity of coconut oil is very disturbing to me. I think it's a major mistake. And then, of course, Dr. Dean Ornish, following up on the work of Framingham, was able to, has been with pre and post angiography studies at the University of Stanford, has shown that he can, in certain cases, take people with advanced atherosclerosis and open their arteries up and improve their overall cardiovascular function and reduce the risk of heart disease by putting them on a very aggressive diet that keeps the saturated fat out. So in those high-risk people, right, no beef, no pork, no high-fat dairy, no vegetable, he doesn't even allow chicken or turkey or fish. He's down to a vegan sort of plant-based diet, some non-fat dairy products like non-fat yogurt he will allow, egg whites he will allow, some nuts, some avocados. He focuses on soy products. And this same diet has also been shown to stabilize localized prostate cancer in a very interesting study that he published with men that had localized prostate cancer. So it's the best of all worlds, right? A diet like this helps to prevent cancer and heart disease, the two leading killers. So LDL cholesterol in 2020 meta-analysis has also been now identified as being an independent risk factor for Alzheimer's disease, one of the major things that afflicts an aging population. That LDL cholesterol laying down cholesterol in the vascular system, in the brain, in the carotid arteries, depriving brain cells of oxygen and other nutrients, leading to vascular dementias and Alzheimer's disease. So vascular dementias are up to 30% of all cases of dementia. It's really just allowing more blood flow to the brain becomes very important. If you really want to know where you stand, because some people say to me, I don't believe this whole cholesterol story. I would say just go and have a carotid artery ultrasound done. And then you'll know if your high cholesterol is actually clogging your arteries and setting you up for stroke and vascular dementias and other problems. That's a really good indicator. Because a lot of people say, hey, my cholesterol's high. I don't really worry about that. I go, well, you know what? Go and have a carotid artery ultrasound. Because if your carotid arteries are more than 50% occluded, we know your risk of stroke is greater than 50% compared to someone whose arteries are not clogged in the same way. That's really a definitive way to determine where your risk is. So how do you lower your cholesterol? Remember that about 10% of the population have some genetic problems. I explained this in the full length webinar that I have on this subject, where I explained, what genetic things you can inherit. But 90% of people can get their cholesterol down if they just lower their intake of long chain saturated fats, as William Castelli did, and their trans fats and fried foods and total cholesterol. So here's sort of the blueprint of how you do it. Pretty straightforward. A lot of people can't do it. With my own patients, I say, let's get more specific. And I show them the exact food. I'm going to send this to you. See the exact foods that you want to try to get out of your diet. And it also shows you you can have, if you don't have high risk for cardiovascular disease, you can have some lower fat protein. In my view, you can have chicken breast, turkey breast, Cornish hen, soy products, fish, egg whites, beans, peas, whey protein. These things are great sources of protein that may, in some cases, deliver some of not the best fats in the world, but they're usually not enough to get you in trouble. As William Castelli says, if you just make sure you don't eat more than 15 grams a day of saturated fat, you're doing great. And that's you can do that eating chicken, turkey, fish, Cornish hen, egg whites. That's possible too. Then there's some healthy fats that you see here from olive oil, avocado, fish, nuts, even some peanut butter hummus. These are great ways to get some fat into your body that are not dangerous fats. But the thing is, a lot of people just aren't willing to make these changes. That's the reality. And so we end up with high cholesterol. People take drugs, and they're hoping the drugs are going to save them. This is really how if you don't have any major genetic risks or risk factors that are significant, these are sort of the foods that you can sort of count on if you want to, and usually keep your cholesterol down. I've been able to keep my cholesterol down using these foods in my own diet. And also, increasing soluble fiber helps to lower cholesterol because it drags cholesterol and bile acids out of the body. Remember, bile acids are the building block of cholesterol. Artichokes are great, by the way. It's often forgotten about. And then there's lipid-lowering drugs that this is what doctors do. Your cholesterol's high, they write prescriptions for lipid-lowering drugs, but lifestyle can get it down. Notice there's some new generation of drugs here. I don't have time to get into it with you, but you might want to look these up as to how they work. One of the fascinating ones here is this PCSK9 gene blocker, where it inhibits the enzyme that breaks down the LDL receptor. So your LDL receptors stay functional longer, clearing more and more LDL cholesterol from your body. It can lower cholesterol by up to 65%. So a lot of doctors are moving towards this particular drug therapy. I think it's an injectable drug for this, but all these drugs have side effects and potential side effects. Some natural supplements that lower cholesterol, gum google is unbelievable. From the mucilmyr tree, it's been shown to increase LDL clearance by the liver, and then the liver converts that cholesterol into bile acids and flushes through the intestinal tract, and you lower your cholesterol very significantly in about 70% of cases. It also lowers triglycerides. It improves the HDL to LDL ratio. A great review study in 2007 shows that it helps to clear more LDL cholesterol, pumps more cholesterol through the biliary tract as bile, and then it turns on the bile salt export pump. So you pump more of that bile into the intestinal tract, it leaves the body as fecal matter. And so as the liver is clearing more cholesterol this way, it's taking more LDL cholesterol out of the circulation, your LDL is going down. Gum google also is decreasing free radical damage to LDL cholesterol, which is an important way to make it less atherogenic. And it increases the HDL cholesterol, and it has anti-inflammatory effects. And artichoke leaf extract is also incredible because it helps to flush more bile through the liver into the intestinal tract. So the liver then has to take more cholesterol out of the bloodstream in the form of LDL to convert it into bile. So now your LDL cholesterol is going down, and you're basically excreting it out of the body in the form of bile acids every time you have a bowel movement. So artichoke is incredible. A great 2016 study with diabetic rats showing its cholesterol lowering effect, has antioxidant effects, protects the liver, also lowers blood sugar. There's different active constituents in artichoke that are doing these things that have been identified. So it has tremendous application to lower cholesterol and blood glucose, support liver health, boost antioxidant defenses, a great source of dietary fiber. So include artichokes in your diet. Encourage your patients to add them to salads and bean salads. One of the great cholesterol strategies to have a bean salad and add artichoke leaf extract and some olive oil, sort of extra virgin olive oil to that. And vinegar, because vinegar slows down the absorption of carbs into the bloodstream. At Adiva, we make this really incredible supplement called Coli Forte, which is the combination of gum google with artichoke leaf extract using the standardized grade and dosages that have been shown to lower cholesterol, triglycerides, and even glucose levels. If you don't know about this product, it is quite exceptional. The only drawback is that the person has to take 3 capsules twice daily. So it's a bit of a chore to swallow that many pills. But someone who wants to go the natural route, this is the way that they should apply that to see if they can avoid using drugs if possible. What I've also given you is, I know that high cholesterol is not the only risk factor for cardiovascular disease. I've been reading research for a long time. I know I featured that a lot today, but here are the 24 parameters that give you cardiovascular risk. And what I've given you on this form, which I'll send to you, is what is the ideal range for longevity for each of the major parameters: total cholesterol, triglycerides, homocysteine, the INR, blood pressure readings, HDL, total cholesterol to HDL ratio, waist circumference, diabetes? What's your fasting glucose? What should it be? C-reactive protein, fibrinogen, fructosamine? What uric acid level are you striving for? Do you have metabolic syndrome? What should your LDL cholesterol be? And then remember that with kidney disease increases risk of heart disease. A lot of people have declining kidney function die of a heart attack. So you want to look at kidney function as well. So it's all there. Recall also that statin drugs are blocking the synthesis of cholesterol. At this step, they're HMG-CoA reductase inhibitors, but they're also blocking the synthesis of coenzyme Q10, as I've told you before, which can lead to congestive heart failure. And because statin drugs are blocking cholesterol synthesis in all tissues, including muscle, often you get painful myopathies. Some studies show that giving people vitamin E and vitamin D and CoQ10 supplements can reduce the muscle pain associated with statin drugs. Most medical doctors don't know that. And so if a person is on a statin drug, they should be taking our all-in-one multivitamin as well as cardio essentials. So of course, our all-in-one multi, in terms of cardiovascular features, it has antioxidants that protect the LDL cholesterol from oxidation, like vitamin E. The vascular system has many vitamin D receptors. The B50 complex keeps homocysteine down. Calcium and magnesium help to keep blood pressure down. And selenium is very important in preventing heart failure and also acts as an LDL protective agent. So that's the full breadth of the multivitamin. Many of you know about that already. And of course, cardio essentials after the age of 45, when you're making less CoQ10, that becomes very important to prevent congestive heart failure. But if a person is on a statin drug, they should be taking 3 capsules a day. Dr. Castelli, I'm very grateful to have read his papers over the years. He gave us some of the targets to shoot for to prevent cardiovascular disease. Those are his recommendations. He's saying in 40 years of Framingham, people that have a total blood cholesterol below 150, only about 6 people over the years have ever had a heart event if their cholesterol was that low. Get your total cholesterol and your LDL cholesterol down as low as possible. It's my best advice. He did a great interview in 2011. If you want to listen to it, that's the link where he's saying, the total cholesterol to HDL ratio is also emerging as a very important predictor. So it's a great interview if you want to hear him speak live. He's a real gentleman and a real class act in my view. So I want to thank you for sitting in today. I really appreciate it.